I'm the technical lead for 2 of the countries, which are part of the Data for Health countries. And being a technical lead essentially involves all the different implementations and programs we have. I supervise these. My work in the Philippines actually goes back to 2009. At that stage, I was working for the Health Metrics Network, and we were doing an assessment of their health information system. Of course, CRVS is part of that, and I had the opportunity already then to get a good impression of what were the problems they had. And later on, when I worked at the University of Queensland in 2009, it was quite clear that the Philippines is not a country which has any problems in general with collecting data. They do that. They have a very good office which conducts censuses, have done for many years. They have a good civil registration system with a relatively high completeness. So the problem they had was essentially that the data wasn't of sufficient quality to really being used for policy decisions. And that's why I was really delighted when we started the Data for Health project, because of the specific focus on quality of causes of death, which really is the main problem here in the Philippines. Well, we of course contacted what was going to be our partners, so the Department of Health. We sat down, we showed them the assessment, we showed them the baseline that we had drawn both in 2009 and later on in 2016. And it wasn't difficult to see. It was standing out that it was medical certification. It was the fact that once that the doctors had written these certificates, the coding was not also up to scratch. And because it was all done manually, and there is 500,000 of these death certificates a year, clearly it took quite a while to get that data collected, cleaned, and then published for use. And then, of course, because more than 60% do not die in hospitals here, finding a way to improve the certification, which already is being done in Philippines by doctors who lives in these rural areas, but who have not got a lot of information about what that person died from. So that then turned into being the verbal autopsy recommendations, which we did, and which we immediately then started getting support from, also from the partners that they worked with. The key issues that we ended up with was improving medical certification in hospitals and improving with Smart VA the certification of causes of death, which is done in the community. And then once that data goes to the office where they code, to introduce an automated coding system which would standardize and make it quicker for that office to produce the data which they need. And then we introduced a fourth thing, which is a tool, a software, to analyze the quality of the data. So after the data has been coded and before it's being published, it is passed through this tool so they can correct any quality issues. When you start implementing that, you see that things has to be modified, or things you thought were in one way were slightly different. For example, in their way of doing things concerning medical certification, they offered training to hospitals. But there's many hospitals in the Philippines. So if we were going just to offer training, we will be training for the next 20 years here. So we said we have to have a different strategy, not just going training in hospitals, because doctors leave that hospitals, and what will happen next? So our medical certification strategy is actually to train trainers who are based in the hospitals. In each hospital, we have trained between 2 and 5 doctors who work there, and who then becomes responsible for training their colleagues. We provide all the training materials, all the manuals we have produced and which they are using for this training, they have, and they are now in these 50 big hospital we chose. We are now running this as a pilot. By selecting the 50 largest hospitals, not only do you have a very big impact, because essentially 40% of all medical certificates come from these hospitals. So even if that was the only thing we did, we would be able to see in the data a significant impact and improvement. But also, when you choose such big hospitals, they are, if you want, the training centers for other hospitals. They are the referral places where doctors would send and would want to be like these hospitals. So you create champions, 50 champions in medical certification in the Philippines. So that will have a massive impact on the quality of the data. I think perhaps the example I can think of immediately is from the workshop I just come out of, where we have trained rural doctors in using smart VA. So it's an automated tool, again, to arrive at a probable cause of death. And these doctors, until we started really training them, I think had never thought that it was important what they were doing. The law says that a dead person cannot be buried without a cause of death. So people meaning the family usually brings to the particular rural doctor a request from the civil registrar to indicate what was the cause of death. They probably saw this as a burden because they had other things to do. So they would say, oh, what was the age? Oh, it was 70, oh, well, senility, old age, stop breathing, things like that, not giving it at all any consideration. And it probably was not because they were incompetent, but because they couldn't see what was the point in doing this. When they know now, first of all, that these death certificates are really the cornerstones of all their health information about what people die from, come from them. And as I said, 60% of the deaths are coming from the certificates they write. So it is a massive impact. When you write garbage, you get garbage, right? So that in itself was a light bulb movement, that we explained to them that this actually was an important piece of paper they were writing. And then giving them a tool which they could use, and which actually just by doing an interview in a standardized way, could tell them what is the most probable cause of death, has really changed their life. But also, I must say that the Philippines have a very open attitude to change, and they have a strong national pride. They want to improve, and they want to be among the forerunners here in Asia. And so they are open to new things, and they're lovely people. Anyone who works in the Philippines, I'm sure, agrees with me that their disposition, their openness is very pleasant. But I think in other ways, perhaps the fact that their administrations can work together. We have had great problems in many other countries. Here, since 2009, where we insisted that the country should think of getting a body, an overarching body, to improve the whole CRVS system. Since then, they have actually had many meetings where they have tried to align procedures and exchange information. And that has made it easier for us now to work there. We have created this tool which now is for doctors, this automated verbal autopsy, which for the first time is being used by doctors. Before, doctors played no primary role. They were not the interviewers, etc. They were not the direct users of the interviews. And here they are. And I think that has made that they will become an example country. They can say, we are the first to do this. And now with us continuing this work, there will be other tools that we will first pilot up here in the Philippines and then share with other countries these experiences. So yeah, they are becoming champions themselves.